between each vertebrae of the spine, from the top to the bottom, is a disc. And the anatomy of the disc for basic purposes is really like a jelly donut. It's got a soft liquid or jelly center and a very, very thick donut ring. The donut ring of the disc, the actual donut, has a lot of fibers that we perceive of as back pain. So if we were to stick a needle into the donut ring and inject a little fluid, the person would describe terrible back pain. Inside the donut is the jelly. That has no pain fibers. The anatomy of the jelly is kind of like, it's almost structured like a crab meat structure. It's a soft, gelatinous material. So when people injure their discs, you have to decide whether they've injured the annulus, the donut ring, or whether we're dealing with a jelly problem. If we think of the disc like a jelly donut, the most common basic problem that happens is that the donut ring will tear. And when the donut ring tears, there's actually a hole in the donut, and it allows some of the jelly to escape. If that jelly escapes, what sits right next to it is the sciatic nerve, or the nerve that goes down the leg. So a classic disc problem in a middle-aged person requires the donut ring to tear, the jelly to pop out of the donut, and that piece of jelly hits the nerve and they get pain down the leg. The definition of sciatica is pain down the leg. There are lots of reasons to get sciatica. A disc problem is just one of them. Anything that presses on that nerve will cause pain down the leg. So if the disc ruptures and a piece of jelly pops out, the patient's going to complain of pain down the leg. In older people, 50s, 60s, 70s, 80s, they get arthritic spurs in their back. If the arthritic spur presses the nerve, they'll complain of the same pain down the leg, or sciatica. So when it's a disc, we call it a disc. We tend to just use the term disc. The general population gets caught up between disc rupture, disc herniation, disc bulge, and sciatica. But in essence, they all mean the same thing.